All right, so for the next one, we're talking about another type of what? Sterilization. And this type of sterilization is what is known as the Irving sterilization. Irving sterilization. So this Irving sterilization, we'll discuss how this one is done. Okay, so have different types of sterilizations. Okay, different types. We're actually focusing on the Irving. Now from the picture you could actually see how the Irving is done. Okay, are you noticing something? Right, so we'll discuss it in the lecture. We'll compare it to what you are seeing in the pictures. It will make more sense. So it's a specialized form of female tubal sterilization. It involves surgically altering the fallopian tubes to prevent pregnancy. So it's considered a permanent method of contraception, and it's typically performed during or after childbirth. Especially like they just do a cesarean section. So they bring out the baby, they just do the procedure for you. I don't know if you understand. So they use one stone to kill two birds. Okay, literally. So it was introduced by Dr. Frederick Irving in the mid-20s. So a segment of each fallopian tube is excised, that's cut out, and the proximal uterine end is buried into the muscular wall of the uterus. So the distal end is left free. See, they cut it out here, right? They now buried it inside. Okay, so this double sealing methods reduces the chances of what? Recanalization, that's joining of the tubes. Okay, so sealing it up here, okay, also tying it here gives like a double security so that childbirth doesn't come up. So you know, they're just trying to like compare the Irving's method with what? Pomeroy method, Parkland, salpingectomy, clip and band methods, right? So this one is basically for any student that wants to know the difference. Okay, for me, just came to tell you guys how the Irving is done. Okay, so I was trying to talk about the difficulties too, also the descriptions, right? Just the differences between the different methods. So advantages, it doesn't fail, right? It rarely does it fail. There's a reduced risk of what? Ectopic pregnancy. It's often performed during cesarean delivery, just like I told you guys. So the woman has opted that, okay, she doesn't want to give birth after this. Okay, so they just go in for all of it, right? It's mostly for women that have not been able to give birth through the vagina. So she's tired, she doesn't want to give birth again. Okay, so that's it for the Irving's sterilization methods for females.